I'm going to dispel the myths of chiropractic. There's lots of misconceptions out there online and in public, and I'm here to share the reality of the chiropractic profession. Myth number 1, chiropractors only crack backs. So chiropractors go to grad school for 4 years after university, and we learn everything to do with muscles, nerves, and joints from head to toe, how to diagnose and treat these conditions. Chiropractors learn everything medical doctors learn in undergraduate school, so when somebody walks into our office, we can figure out if their pain is coming from a muscle, a nerve, a joint, or an organ. That way we can properly decide if they should be a patient for chiropractors, or we send them back to their doctor for further investigation. Here's another myth. Chiropractors align the spine. If you're not in alignment, then the body's not going to be healthy. What are we doing? Is the spine really out of alignment? What happens to the spine when we see a patient and adjust it?
It's actually not true. If it were, think about how hockey players or football players getting body checked or tackled, how their spine would look. What we do with our adjustments is a high velocity, low amplitude, which means fast but not very forceful, quick movement of a joint. So it's within the normal range of motion, and that little noise you hear is just air bubbles escaping, like if you opened a can of Coke and the air bubbles escape out of the joint. And all it does is really maintain the joint's normal range of motion. It doesn't realign anything, it doesn't permanently change the positions of bones or joints or anything like that, but it does provide temporary relief and a reduction in pain. What about some of the myths surrounding massage therapy? What do you hear?
Sometimes people think I'm doing an adjustment when they hear crackling, when we compress the tissues, and it's not an adjustment because that's what you do. It's just an incidental thing from stiffness and structures that don't move much. So sometimes I might be squeezing someone's forearm and wrist, and they'll hear these loud crackling noises, and they think I'm doing something out of my scope of practice, but in fact I'm not trying to do that at all.
So there's another myth that I hear sometimes from my patients when I try to get them to see a massage therapist. They tell me, I've had massage before, it's only temporary relief. So what would you say to that?
I can see why they would say that. A lot of massage therapy is doing something to the muscles rather than teaching the muscles to do new things that they're not used to doing to change the overall condition. So I try to combine both approaches by asking patients to do new movements such as more supination with resistance, because we tend to be very pronation dominant. And while they're doing that, I can then move their tissues more easily, so less discomfort for them and more lasting results. All right, any discomfort leaning against the wall there?
A little bit of neck pain.
Oh, when you try to reach back?
When I try to go back.
Why not bring your feet a little away from the wall, yeah, and then use the wall more like a chair. Does that help at all?
Yeah.
All right, and then can you get your arms up against the wall in a cactus shape? Any discomfort there?
A little on my right shoulder.
All right, what if you press your low back into the wall and then take a deep breath? Is the shoulder able to reach, or is it uncomfortable still?
Uncomfortable still.
All right, let's lower it down and just press it that way. Is that all right?
Much better.
Okay. So I'm guessing there's something happening on that side. So I'll take a closer look at that. Can you press this into the wall more?
That hurts
Not
my
really.
neck.
Okay, relax it. Interested to know why your arm is having trouble there. All right, so I'm having trouble moving this on my own. Could you push into your left foot to help this shoulder blade come back? Perfect. And then, there we go. So it's just asking the foundation of the body to help with the rest of the structure. What are the main differences between physiotherapists and chiropractors?
It's a great question. We get that all the time. Chiropractors and physios, we do similar things, but also a little bit different. Physiotherapists have 2 years of grad school, and chiropractors have 4. The difference is we spend more time learning about diagnosis and disease throughout the whole body. So a patient can walk into our office, and we're essentially, family physician in terms of knowledge of what the person's coming in for. So we can make sure we rule in and the patient is a chiropractic patient versus a medical patient. So we can tell if they have something we can treat or not. And physiotherapists don't get that training, but we both do orthopedic exams. We can assess the body for dysfunction, but the difference is essentially the medical knowledge that we have. Some people believe that they only need to see a chiropractor when they're in pain. Is that true?
Well, when you are in pain, it's obviously good to come get treatment and help get it fixed. But there's also a lot of people out there, whether they're athletes or just regular people going about their days, that don't even realize that there's something limiting their performance or their function, and we can help optimize that before any injury even happens. For example, a pitcher or a throwing athlete that wants to just have a little more power or a little better form to mitigate the risk of getting injured, we can help by analyzing the movements and examining the entire area and determining what they need to work on to mitigate the risks and to improve and optimize their performance.
Nice.